what is Ream and Run, why do we do it, and what are the outcomes, and then I'll share a couple pearls as well. So it's a method for managing glenohumeral in patients who wish to avoid the risks of implant wear, loosening, and also avoid surgeon-imposed activity limitations. So what we know from Bill Levine and others is that isolated humeral head arthroplasty does not address the pathologic glenoid, and that can lead to poor results. The Ream and Run actually consists of soft tissue balancing, and as we heard before, it's reaming the glenoid, and you do it at 2 millimeter mismatch, so it's actually 2 millimeters larger. So if you use a 48 head, you're reaming it to 50. So why would you want to do this? Well, polyethylene glenoid component is a huge problem. We've seen that in many, many studies. And the bearing materials, it's pretty good for polyethylene, but we know that there can be problems. So hybrid glenoids have come out. Those also have had a lot of issues. There's some newer designs. So if you're going to really think about doing the Ream and Run, I would encourage you to look at the literature. There's actually quite a few studies out there. There's 39, 8 of which are in JBJS. We'll highlight a couple of them. So the Seattle experience is definitely the largest, 176 patients. So they follow these patients for now, mean follow-up 10 years, 12% revision rate, significant improvement in simple shoulder tests over time. What they've taught us is that male sex, they do better, non-diabetics, and those that start with a lower preoperative simple shoulder test. But again, these are young patients, so reoperation is going to be pretty common because they're challenging patients to treat. Andy Green probably has the largest series outside of Seattle, so he compared anatomic to Ream and Run, so 58 years of age, men. The final forward elevation was actually the same in the two groups, and there was no difference at 5 years, so it just takes a little while for these outcomes to improve, and the dissatisfaction rate was a little bit higher. It was 10% in the Ream and Run group and 7% in the anatomic group. So revisions in his series, 3 for the Ream and Run for pain.